Cholinergic drugs, also known as cholinomimetics, play a crucial role in mimicking or enhancing the action of acetylcholine, a vital neurotransmitter in both the central and peripheral nervous systems. These drugs are broadly categorized into two main types: direct-acting and indirect-acting cholinergic drugs. Direct-acting cholinergic drugs bind directly to cholinergic receptors, mimicking the action of acetylcholine. These receptors are classified into muscarinic and nicotinic receptors. Muscarinic agonists. These drugs act primarily on muscarinic receptors, which are G-protein-coupled receptors. Examples include pilocarpine, used to treat glaucoma by reducing intraocular pressure; bethanechol, utilized to stimulate bladder and gastrointestinal tract motility in cases of urinary retention and ileus; nicotinic agonists. These drugs act on nicotinic receptors, which are ion channel receptors. An example is nicotine. Though primarily known for its role in tobacco products, nicotine replacement therapies use this mechanism to help with smoking cessation. Indirect-acting cholinergic drugs increase the levels of acetylcholine by inhibiting acetylcholinesterase, the enzyme responsible for its breakdown. Reversible acetylcholinesterase inhibitors, neostigmine, commonly used in the management of myasthenia gravis and to reverse the effects of non-depolarizing muscle relaxants post-surgery. Donepezil, widely prescribed for improving cognitive function in Alzheimer's disease. Irreversible acetylcholinesterase inhibitors, organophosphates. These are primarily used as insecticides and have a long-lasting effect on acetylcholinesterase, posing a risk for poisoning. Pharmacodynamics. Cholinergic drugs exert their effects by interacting with cholinergic receptors throughout the body. These interactions can lead to a variety of physiological responses: cardiovascular system, reduction in heart rate, bradycardia, and decreased force of contraction; gastrointestinal system, increased peristalsis and secretion, which can aid in conditions like postoperative ileus; respiratory system, bronchoconstriction and increased bronchial secretions; ocular system, constriction of the pupil, miosis, and reduced intraocular pressure. Pharmacokinetics. The pharmacokinetics of cholinergic drugs involve their absorption, distribution, metabolism, and excretion. Absorption. Many cholinergic drugs are well absorbed orally, though some are administered parenterally or topically to target specific areas. Distribution. These drugs are distributed widely throughout the body, reaching various tissues where cholinergic receptors are present. Metabolism. Primarily metabolized by the liver, though some drugs, like acetylcholinesterase inhibitors, act directly at the synaptic level. Excretion. Excreted via the kidneys, requiring dose adjustments in patients with renal impairment. Clinical uses. Cholinergic drugs are used in a variety of clinical settings. Myasthenia gravis. Drugs like neostigmine improve neuromuscular transmission and muscle strength. Alzheimer's disease. Donepezil enhances cholinergic transmission in the brain, improving cognition. Glaucoma. Pilocarpine reduces intraocular pressure by increasing the outflow of aqueous humor. Postoperative ileus and urinary retention. Bethanechol stimulates gastrointestinal and bladder motility. Side effects and toxicity. The therapeutic use of cholinergic drugs can be associated with several side effects. Muscarinic effects include bradycardia, hypotension, increased secretions, salivation, sweating, lacrimation, diarrhea, and abdominal cramps. Nicotinic effects. At higher doses, these drugs can cause muscle cramps, fasciculations, and, in severe cases, muscle paralysis. Toxicity management. Acute toxicity from cholinergic drugs, particularly organophosphates, requires prompt management. Atropine, a muscarinic antagonist used to counteract the effects of excessive acetylcholine. Pralidoxime, 2-PM, reactivates acetylcholinesterase inhibited by organophosphates, restoring normal function. Future directions. Research continues to explore new cholinergic agents with improved specificity and fewer side effects. Advances in drug delivery systems and the development of selective receptor modulators hold promise for more